to have that Spock, Dr. Spock penguin appearance, so it looks natural. Crow's feet, this is the crow's feet, so one of my favorite procedures. It really enhances your tantalizing eyes. So let's talk about the second, the most popular procedure, which is soft tissue fillers. There are different types. In the past, they have used collagen, which is based from bovine or human, and with that you need pre-treatment skin testing, and it only lasts for about 3 to 6 months. I haven't used that, but this is the most popular, is the hyaluronic acid, which is hyaluronic acid is a sugar that's normally present in our skin. So this compound, it absorbs water. So it's just like a sponge that absorbs water. So it hydrates the skin where it's injected, and it acts as a cushion. And it depends. It usually lasts between 4 to 12 months. It depends on the type of patient, the placement of the fillers. Lips usually last less because it moves a lot and it gets absorbed by the body. Another type of filler is calcium hydroxylapatite. This is a popular brand. It's a microsphere technology, so it has tiny round particles of solid materials that's clumped uniformly together, and it lasts a little longer than hyaluronic acid because there's some collagen growth in between. Sculptra usually is used for cachectic patients with HIV. The only thing with this one is, those two, the first two, you can see the effects right away. With hyaluronic acid, it might absorb 10% more of water, but usually what you see is what you get. With Sculptra, it promotes growth of collagen, and so you really don't see the effect right away. So fillers, they're good for volume replacement. So filling, volumizing. So you see the difference now between that and the neurotoxin. So this is more of adding volume, plumping out the skin, and decreasing the appearance of laxity. It's for mid-face, lips, actually different areas too. I'll mention that later on the next slide. So it smoothens and tightens the skin. Contraindication, if you have, usually with the first two you don't really need skin testing, but there are still rare cases of allergies. With hyaluronic acid, there's an antidote for that, not with radius. Again, ask for you have to stop medications that thin the blood. Also, if you have history of herpes labialis and you want something done around your mouth, make sure you tell the doctor about your history, because you need prophylaxis with valacyclovir or acyclovir. So it's FDA approved for nasolabial fold, your laugh lines, parentheses, and also for marionette lines or oral commissures. These are the lines formed on the corners of your mouth. That can be really deep, and it requires a lot of fillers for that. Off-label, glabellar folds. The line that forms when you frown, sometimes the neurotoxin is not enough to to treat that deep line, so you can put filler on that too. Tear trough, dark circles. It's actually one of my favorite problem to solve, and it really has very dramatic results. Brow lift. You know, if you have too much skin sagginess, you cannot correct it with neurotoxin, you need some fillers too. And it's long lasting than Botox, than neurotoxin. Cheekbone augmentation. Young people have more cheeks, so we have to mimic youthful appearance by putting some cheeks. Perioral lines, as I mentioned, for especially for people who smoke or who loves to pout, fillers is good to stretch out those lines. Lip augmentation was just recently, Restylane, it was recently FDA approved for that indication. Nasal bone augmentation, non-surgical nose job. You can put bridge on your nose too. Another favorite procedure. Chin augmentation, submental crease. If you need some chin, you can do that too. Mandibular grooves or jowls, brought about by gravity, gravitational pull, so you can correct that too. You can smoothen it too. Hand rejuvenation. I mean, you're all tightened up on your face, but your hands will show your age too. So now, you can do fillers. You can put fillers on your hands too. Earlobe repair. You can shape up your ear too, your earlobe with fillers. So there's so many things you can do with fillers. Temporal rejuvenation on your temple areas. You lose volume there too as you age, so you can put fillers on your temples. So these are pictures of before and after. She had correction of laugh lines. This is the immediately after the procedure. So there might be a little bit of redness on the injection site. Possibly can have bruising, but if you bruise, maybe it will last only for about 5 days, less than a week. You really don't have to do anything. You really don't have to put ice after that, but that's how it looks. This is the tear trough. As you can see, the dark circles are much improved. This is immediately after the procedure. This area is very vascular, so there's a big chance of getting a bruise, but it depends on the technique of the injector. But it lasts for about, I would say, 9 to 12 months. It's really good. She is a 63-year-old with prominent eye bags. It's actually worse actually. And she didn't want to be under the knife, so she tried the fillers, and it's really good. Came out really good. Lips. This patient didn't want to have very plump lips, so she's very happy with just minimal lip augmentation. And the excess, I put it on the laugh lines. That's good. Nasal bone augmentation, as you can see, if you look at the eyelashes, a little longer than the bridge, higher than the bridge, but after the filler, nice. So that's immediately after the procedure. So there's a little bit of redness which will disappear in a few hours or maybe days. But you can go back to your, you can go back to work. And it's very natural. It doesn't look like there's something done. Very natural. Okay. All right, so number 3 popular procedure is laser hair removal. And depending on the areas being treated, it can go anywhere from several minutes to several hours to complete. And a low energy laser beam is passed through the skin, and it is attracted to the pigment of the hair. And the energy passes through the shaft, the hair shaft, and goes to the hair follicles of only those in active growth phase. So remember, hair follicles are in different phases. It could be in its dormant state, but it's only effective in actively growing hair. That's why you need to go back. You need to have multiple sessions when you go for laser hair removal. And benefits: it's non-invasive. It treats larger areas effectively. It may also make your skin color and complexion even. So people with dark skin who have facial hair, they might have some folliculitis. That can also be treated with laser treatment. And there's no downtime, has minimal discomfort, and it replaces waxing, electrolysis, shaving, and bleaching. As I said, the only thing is you need multiple sessions to see to become satisfied with the procedure. And also sometimes it might cause redness around the area. And of course you have to wear sunscreen all the time on treated areas. For people with dark skin, it's less responsive because of the discrepancy of the skin color and the hair color, and also for blonde hair and gray hair, they're less responsive because they have ample pigments in the hair. So it's attracted to the pigmentation of the hair. So lasers, IPL stands for intense pulse light. It's becoming more popular now because it doesn't cause damage on the skin. It's attracted on certain areas under the skin. It depends what you're treating. It's for age spots, telangiectasias, port wine stains. So for telangiectasias and port wine stains, it targets the hemoglobin part of the skin. Benign brown pigments, it targets the melanocytes. It's also good for acne, warts, scars, tattoos, and skin tightening. So I'm sure you've heard about Thermage, Accent, that promotes skin tightening, and that is because of the heat that's the light that turns into heat, stimulating the growth of new collagen. So if you have new collagen, it will tighten up your skin too. So anything is possible now. You know how hairy you are, you can do something about that. Acne laser. But this is not just one trip, it's a multiple treatments, multiple number of treatments. Okay. All right, number 4 popular procedure is microdermabrasion. So it's effective in removing the outermost layer of the skin cells, stimulating the cell growth in the underlying dermis, and increases the epidermal thickness. We use either crystals or non-crystal types. Non-crystal type, have you heard about diamond tip microdermabrasion? And it has some suctioning effect too. So both types abrade skin and causes polishing of the skin. So it promotes a smoother, fresher appearance. Texture is improved, fine lines are improved as well, and some pigment